The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Today on Meet the Doctor, my guest is Tyler McElwee. He's a facial plastic surgeon in Houston, and his dog is with us too. And your dog's name is?
His name is Apollo.
Apollo. After Apollo Creed?
Actually, it's a mix between the fact that I'm a big history nerd and my wife wanted something Texas themed for our dog. We weren't living in Texas at the time. And so it was a good blend of like the NASA Apollo program, as well as something at least, I guess, more mythology than true history. My initial name was Julius, and I was shot down pretty hard on that one. So we settled for Apollo.
Oh, my goodness. Yeah. Do you know about the test? You're going to have to try this when you're naming your children, where you go to the playground and yell their name like 10 times loud in a row and see if it feels annoying. Do you know about that?
No, but I think now we have to do that. We like literally just decided on names, I think, the other day.
Yeah.
And yeah, we haven't made blankets yet though, so I guess it's not technically set in stone.
I invented this test because I was at the playground once and I heard these parents yelling Oliver, Oliver, over and over and over. And I wanted to kind of tell them to nicely be quiet. And ever since then, whenever we hear someone yelling Oliver, I look at my husband like.
So the best part is that's one of our kids' names.
No.
So it's funny. So I love the book Oliver Twist. Love the book Oliver Twist. And it's like actually ironic because Charles Dickens is not my favorite author by any stretch. But I've always loved the name Oliver, and now it's popular. But I was like, well, you know what? I've loved it this long, blah, blah. My wife was like, yeah, I like it enough. And we also wanted to name names that we could turn into nicknames, like Ollie, stuff like that. And so,
yeah, Ollie's good.
But I do totally
sorry.
get like, no, don't apologize. I hear you, but no, we're looking at
what are the chances?
I know. Well, so it turns out Oliver is actually one of the most popular names today, and I was actually kind of annoyed to hear that because I was like, I've liked this name long before it was popular. Like, come on, guys. Just so happens that the trend caught up to me, and now I look like I'm caught up in the trend. But c'est la vie. I know, what are the odds? As soon as you said that, I just had to start laughing. Don't worry about it. It's just, I hear you.
Oh, this interview is off to an excellent start. I've already insulted you.
No, it's good. It's good.
Be serious, for real. Okay.
So, for real.
You ran home from work in the middle of the day to talk to me, which I really appreciate. Tell me a little bit about work and what that looks like for you these days.
So work has been wonderful. I joined Memorial Plastic Surgery as their facial plastic surgeon. They were so busy with body, and they were so good at body that they had a hard time incorporating face because it would take them a little bit longer. They're used to their routine and body, and so they wanted to bring on somebody to do face, and that's me. And I joined them because I am somebody who I know what I'm good at, and I know what I'm not as good at. And I think I'm good at surgery. I think I'm good with patients. I am not good at business and marketing and, that side of things. And so I wanted to join a practice that already had those kind of mechanisms in place to help me get where I want to be. They are helping me get patients in the door, and I am having the time of my life operating and meeting new people. And so it's been kind of a very good match so far.
So what kinds of things are you doing every day? Rhinoplasty, facelift, everything?
Pretty much, I tell patients everything from the collarbones on up. So neck lifts, facelifts, lefts, which are eyelid lifts, brow lifts, forehead reductions, rhinoplasties, nose jobs, ear pinnings or otoplasties, in other words, scar revisions, and then even like, laser resurfacing for skin, and then injectables, your fillers, your Botox Dysport stuff. So if it's above the collarbones, I am not afraid to tackle it.
I've been thinking a lot lately about why you should find somebody extremely qualified just for something simple like Botox or filler. Do you have any thoughts on that you can share? Am I right? I just
I,
really want to know if
you
I'm right.
are 1,000% right. And so I actually have very strong feelings about this. And the reason I have strong feelings about this is because, if you look, you can go online on Google Images and see like, where do I get Botox injected? And some picture will show like inject here, 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 and here. And there's a very big difference about knowing, quote unquote, what to inject versus why to inject. The knowing why is a dramatic difference. The number of people who hate their forehead wrinkles, but they come in and they say, "Well, I went to so and so and my eyebrows came down." Well, the only muscle that elevates our eyebrows is the same muscle that causes these wrinkles. And so knowing why you inject that and knowing what can happen is a major factor. Now, luckily for Botox and Dysport, you can't hurt somebody with it permanently. It all wears off. It's the best and the worst thing about it. But then you start getting into filler territory, and you see all these places doing quote unquote liquid rhinoplasties and stuff, and that becomes a very dangerous game because if you don't know what you're doing there, you can potentially blind somebody. There can be very serious consequences if you don't know why you're doing what you're doing and what really lies underneath. It's not just putting filler to put filler there. There are structures underneath that are important and can cause problems if damaged. And so I think it's very, very important to vet whoever's working on your face.
When you're in training to be a facial plastic surgeon, what kinds of things do you do to learn what's underneath the surface of the face?
So I have operated on places in the head and neck that I hope to never see again, to be quite honest with you. And what I mean by that is I've done a lot of like head and neck cancer and reconstruction there all over the face. If it's an anatomic structure in the head and the neck, I have seen it firsthand. It's a blessing and a curse because some areas, when you're dealing with cancer, you have to get that deep. I mean, you got to cure the disease. That's the point of doing the surgery. But it does give you a very, very, very good understanding of all of the anatomy and how it interplays. I've seen the structures that I'm worried about injecting. It's not just this mythical thing underneath the skin to me. I've seen it live. I've seen it in every which way, every confirmation. And I think that gives me, a good understanding of why I'm doing what I'm doing.
How many faces do you think you've seen the inside of?
I can go back and look at my case logs, but it's going to be in the high 3 to low 4 digits at least, just from training alone. And so it's a lot of faces, a lot of necks, a lot of anatomy.
And then do you think there's injectors out there who've never seen it?
Absolutely, I do.
Yeah.
Pretty much anyone who isn't a surgeon has probably never seen the anatomy outside of maybe a cadaver lab. They've never seen
Yeah.
and I'll be honest, I've done a good number of cadaver labs. They're great training tools, but they never replace the real thing. Structures are so much more variable in the real thing than just a cookie cutter cadaver. And so there's nothing that replaces surgical training.
And is there variation between people, under the surface? Is everyone's face the same or completely different?
It's not completely different, but there's variables. And those are things to know about. For facelifts, great example. One of the most important parts of surgery is protecting something called the facial nerve. The facial nerve comes out just in front of our ear in the middle of that big spit gland called our parotid gland. And then it splays out into 5 branches. Now, generally speaking, those 5 branches go the same trajectory. There's little anatomic markers that, us facial plastic surgeons all know about that approximates the course. But that's exactly what it is. It's an approximation. So you can't just assume that it's going to fall perfectly on that line that you've drawn out. The marginal branch that comes down, most of the time, it doesn't come back up over the mandible. Some, but about 10 to 15% of the time it does. Just knowing that is a possibility and not just assuming, oh, well, in this generic textbook, it said it just goes this course. So that must be the course it always goes. That's the kind of stuff where those are the pitfalls that you can run into if you haven't done this enough times.
So tell us a little more about your training and where you did have the privilege to see underneath roughly 400 faces. Where were you doing that and what was that like?
Fortunately and unfortunately, a little bit more than 400. It was like closer to 4 digits. But I'm from Southern Louisiana, and I really wanted to go back there to train because I knew I'd probably never settle down back home, but I wanted to live there, one more time when I was young enough to enjoy it. So I trained at LSU in New Orleans. and it was phenomenal. One of the perks there is that there's a lot of, it's not really, it's a perk from a training standpoint, but it's a sad ordeal. There's a lot of indigent patients that can't get care elsewhere. So they come to you with problems that are generally farther gone than the average person is going to present to a physician with. And so it was no shortage from a patient population standpoint. And because the supply of patients outweighed the demand of doctors, even as early as intern year, like you're kind of thrust into the situation in a lot of ways. And it got me a lot of great operative experience that I don't think I would have gotten in a lot of other training programs, to be quite honest with you. Again, just you're kind of thrust into the picture because everything's on fire and there's only so many firefighters. You know what I mean?
Mm-hmm.
So it was a great experience.
And this is in New Orleans.
Yes.
So you're working like this is, and you were a resident here?
Yes, resident.
There.
Yeah, I was a resident there.
So you're basically living at the hospital
Mhm.
and you're drowning or trying not to drown, probably in patient volume most of this time, right?
Mm-hmm.
Yeah.
Patient volume was sky high.
So for how long did this go on?
So residency is 5 years. And then I did a fellowship after that for a year, specializing in just cosmetics. So like, all the faceless, like rhinoplasty, the cosmetic side of things. And so fellowships, it's a tough year, but it's residency is the toughest. I mean, and it's not even just tough on me. It's tough on spouses. It's tough on family. You're never around. Like you said, it's called residency because you live at the hospital basically, but it's a very worthwhile endeavor. Now I can say that now that I'm on the other side of things.
Sure. Yeah.
It's like I said, the experience is unparalleled from a training standpoint. It really is.
And was this when you figured out that you wanted to head towards aesthetics? Was during this time?
It was because, like I said, we dealt with a lot of cancer, and we'll kind of take a step to a lot of skin cancer. And that indigent population, they really didn't have like a Mohs surgeon that could make tiny defects in the face and kind of repair tiny defects. So we did all of our own excisions and repairs. And some of these repairs are pretty complex, reconstructing eyelids, reconstructing lips, reconstructing noses. And so that's what started gearing me into like the aesthetic side of things, because you take people who have been just fine their whole life, and you give them this disfiguring defect, and you got to make it look nice. People don't want to walk around with missing half an eyelid. No, they can't either. But it's a cosmetic thing, and you give these people confidence back. One of my favorite patients in all of my training as a gentleman who had long, like punk rocker-esque hair. He's like in his late 50s, and he had a very large squamous cell on his scalp. And his only request was, I don't want a bald spot there. He's got this long hair, and then he didn't want just a giant bald spot right there where it was. And I was like, all right, I got you. And through a couple little rotational flaps and things like that, you could never tell anything happened. And the defect was probably a good 6.5 centimeter diameter, maybe 7 centimeter diameter. It's a pretty good size, and you can't tell anything happened. And like, he is the most ecstatic person in the world over it. It's just giving people that confidence that like their look, that I'm a big believer in like, you look good, you feel good. If you think you look good, you feel good. And so he's not going to want to walk around with a bald spot, like this giant disfigured spot right there. And is it something that's kind of silly to think about? Like, okay, it's just a bald spot, so what? We all have like little insecurities that bother us, whether they bother other people. And so that's only human. And so he worried about it, and I'm happy to be able to give that confidence back to him.
So you said earlier you went back to Louisiana. So you grew up in Louisiana and you came back to Louisiana, but what did you do in between those two Louisianas?
Moved to Houston.
Oh.
Just before high school. My dad had got a job in the oil and gas industry after going back to college when I was a kid.
But he made you leave in the middle of high school?
No, just before high school.
Just before.
Yeah, it was a good time to transition. And so I ended up staying in Texas for undergraduate at Texas A&M. Graduated summa cum laude there, then went to Baylor College of Medicine for my med school. That's where I met my wife, who is a Houstonian born and bred. So it's probably a foregone conclusion that we were going to come back to Houston at some point. Yeah. But I did want to live in Louisiana one more time before, settling down wherever we settled down, which of course so happened to be happy wife, happy life, Houston.
So you've never lived north of I-10?
No, I guess College Station technically, but I mean,
I guess technically.
Well, But outside of that, no,
Maybe
not
a
like
little bit.
I used to joke that I-10 is like the wall from Game of Thrones. Like it's this northern border that no one dare cross.
It's cold up there. You don't want to go
Exactly.
past it.
Exactly.
That's good. So you're at Memorial now. And how long have you been there?
So we just moved to Houston a few months ago. So I've been there for 2 months now.
Okay, so you have a brand new team around you, new staff, new everybody, new
Mm-hmm.
patients. Are they starting to get to know you, and how do you think they would describe you?
So it's actually funny because just today, one of them told me that this is just really gratifying to hear. And I'm not somebody who likes to compliment myself, but like they should have told me they were super happy I joined because I'm very easygoing, I'm fun to work with, and just like enjoyable to be around. And I thought that was the most like heartwarming thing I think I've ever heard in my life. But I try to be that way. You know, we've all been on teams in any capacity work related that don't fire on all cylinders together. And it's pretty miserable for everybody involved. And I believe like when everything's firing on all cylinders and the teams are working together and teams are happy to be there, that's when you get your best results because everybody wants, like, they're not just trudging along to get to the goal. They want to get to the goal. And so I think even back in training, I was as a chief resident. I'd always, I was never one to yell at people. I was never one to be like that kind of, personality. Somebody makes a mistake. What are you going to do about it? You can't go back in time and make sure it didn't happen. All you can say is, listen, move forward for the next time. And so I always try to be easygoing. And it was just really heartwarming to hear that they notice it and feel that way too.
My mentor always says that when the staff are happy, the patients are happy.
Mm-hmm.
And it sounds like your staff's pretty happy.
Mm-hmm. I'd say so. They're all great. I love the people I work with.
Do you think the patients can tell?
Yes.
Yeah.
Yes. I think it's the same way. Like sometimes this Gen Z, as this might sound, the vibes are sometimes off. You can just tell when you walk in a room that like there's some tension, you don't even have to know what's going on, but people can just tell that kind of stuff. I really believe that people are very good on picking up on the little hidden clues and hidden signals that are going on. Whether they know what it means or not, they just know something's off.
There's an office where I used to go all the time, and I loved the provider, and that was why I went there. But every time I went, the front desk had a bench right in front of where you would check in. So you'd walk up to the front desk, and then they'd have this stupid bench right in front.
Mm-hmm.
So you'd sort of be like, do you really want me here? Or are you trying to tell me something with this bench? And I think about that bench a lot because sometimes we do things in our offices because we forget what it's like to be scared,
Mm-hmm.
or to be nervous, or to feel vulnerable coming somewhere like a cosmetic surgery office for the first time. And all they had to do was move the bench like 6 feet to the left. And it would have felt a lot better.
It's funny you mentioned that. I'm a big believer in that the patient experience is what matters just as much as the result. When I was interviewing for fellowship, we're talking to one of the fellowship directors, big guy out in Salt Lake City. And he was saying that he charges X amount more for his rhinoplasty as competition. He goes, do I think I'm better than them? I do. Do I think I'm that like X amount better than them? Probably not. But the experience I provide, patients believe it. And I always think about that because there's a lot of great surgeons in Houston. I'm not going to pretend that I'm like this mecca of surgeon. I think I'm a very good surgeon. Don't get me wrong. But what differentiates it is the patient experience. I want to roll out the red carpet for these people. I want my patients to be happy in all facets. I don't want them to have a single hiccup, whether it's administrative or what, and they shouldn't. No one else in my family is in medicine. And so I keep that in mind because I've never been like just on the medicine side of things. I've been on the other side of things plenty too. And I just keep in mind what it's like to be a patient, their trials and tribulations with their clinics and stuff like that. And, I think it's very, very important to provide that perfect patient experience.
Can you give us some examples of how you do that for your patients?
Sure. Every patient I operate on, I give them my cell phone number. I want them to call me. I want them to text me. I don't care what time of day or night it is. I actually just had a facelift text me earlier saying, hey, I hate to bother you about this. It's probably fine. And it was fine. But it's like, I would much rather you let me know if you have any question whatsoever, because I want to be there to answer for you. I do a ton of these. you do one. There's no such thing as a stupid question, no such thing as a silly question. Just fire away and ask. And so, when patients get here, like they're escorted everywhere effectively. I mean, you're not just going to say, oh, the exit sign's over there. Like, no, we'll walk you to point A to point B. We are your buddy in this process. We are all in a team, and we're going to treat each other like that. I want patients to feel as comfortable as possible in all aspects here. Besides having great results, that's my goal.
Is it easy? I know Houston's a crazy big city and there's lots of traffic and lots of people, and you're in a kind of a busy part of town, but is it easy to get in and out of the office once you're actually there?
It is. We have a great location right off I-10. And so it's easy to duck right off and duck right back on. We're not like nestled away in like an obscure area. It's right off I-10. Our building is on I-10.
And if you're coming from, another part of town or even from outside of town, what's around the office that's fun to do?
So we're just outside of Inside the Loop. Now, for anyone who's not from Houston, Inside the Loop has a different meaning because there are now 3 loops around Houston. It is just that big. And so we're just outside the innermost loop, which is like Houston proper. And so within 5 minutes of our office, there is any restaurant you could possibly want. Parks, there's music venues. You are not that far from any major sports like venue. I mean, if you're here getting surgery and recovering, there's still a lot you can do. Now, don't overdo it if you're post-op, don't get me wrong, but there's still a lot you can do in Houston, and it's all right next to the office.
I can vouch. It's a great part of town. Well, outside of the office, you've mentioned your wife and your wonderful dog Apollo. So I assume you guys like to take the dog places, but what else do you like to do when you're not at work?
We do. Outside of the office, you can find me either on a tennis court or in the kitchen. I love playing tennis. It's been like my competitive outlet, for better and worse. It also keeps me active. Another thing is I love to cook. The latter is a side effect of being raised in Louisiana. Being from Louisiana and knowing how to cook is like it's as important as knowing how to swim. So I think I make a pretty good gumbo and a pretty good crawfish etouffee, if I do say so myself. But I enjoy cooking. It's a ton of fun to me. And so, but I guess outside of that, yeah, spending time with the wife and the dog. We like to do a lot of outdoorsy stuff like farmers markets, bring the dog along. We're both big hikers, but there's not a lot of hiking in Houston. So we just plan most of our vacations around hiking and national parks and all that jazz.
If we're interested in coming to see you or potentially schedule a consult and get to know you better, how should we reach out?
So the best way is through an inquiry on the website, which is just memorialplasticsurgery.com. A couple little questions about what you're interested in, a little bit medical history wise, all that jazz. That's the easiest way because our patient care coordinators are pretty on the ball about getting those leads and getting back to people, getting you where you need to be. That's going to be the best way. I also, on my Instagram, Dr.Tyler McElwee, I respond to a lot of messages as well because I understand that's become an increasingly popular marketing tool effectively, but also way for patients to quote unquote shop around. And so I know a lot of physicians just have somebody run their professional Instagram and all that jazz and whatnot. But I guess to me, I do too, to some degree, but I have access to it. I get on it and I respond to messages as well. People are asking, hey, do you do this? Hey, do you do that? I'm happy to talk to people. I went into medicine because I like interpersonal relationships. So where should I draw that line? To me, it's not a line to be drawn.
Agree. Very wise. Thank you. All right. Thank you for sharing so much of yourself with us today and Apollo. So I think he's the first dog that's ever actually been on the show.
Is he? Because I'll let you know, this is 1, 2, 3, 4, 5, 6, 7, 8. He has toy number 9 in his mouth.
That many dog toys.
So he is a persistent dog, just like me, for better or worse. But yeah.
Thank you. Thanks, Apollo.
Thanks, bud. Thanks for cheering me on.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, THEAXIS.io.